I'm Dr. Lisa Bard-Levine, CEO of the MAVEN Project, Medical Alumni Volunteer Expert Network. Thank you for giving me the opportunity to share our organization with you. Access to medical care continues to be one of the most challenging issues facing our nation, and the MAVEN Project is on a mission to change that. Certainly, many of you are aware of the growing number of uninsured and patients on Medicaid around the country, and the growing shortage of physicians as well. In addition, there's a 20-year gap in life expectancy between the wealthy and poor, and certainly activities in Washington, D.C. exacerbate the problem. The MAVEN Project is here to really close the gaps on access to care for the patients that are either uninsured or on Medicaid around the country, and in particular in California. The MAVEN Project was founded by Dr. Lori Green, who is a San Francisco-based OBGYN, who at the time of envisioning the organization was the president of the Harvard Medical School Alumni Association. Lori was running a meeting one day and looked around and saw all of these expert physicians sitting in the room in front of her, some of which were in active practice, some of which had an active license and were in industry, and many of which were semi-retired or recently retired, and recognized that we have this growing and unmet need for exactly the knowledge and expertise sitting in the room in front of her. And the light bulb went off, which was, could we connect these parties via telehealth technology and close the gaps on access to care? And hence the MAVEN Project was formed. The MAVEN Project is a nonprofit 501c3 healthcare organization that connects physicians who volunteer their time of various specialties to clinics serving the uninsured and the underinsured around the country via telehealth technology. The goals of the MAVEN Project are really to increase access to care for those who ordinarily don't have access or have challenged access to care, to improve health outcomes of populations, to manage chronic conditions earlier and sooner, to avoid escalation of conditions that lead to emergency room visits and hospitalizations, and really to avoid unnecessary costs and burden to the patient, to the health system, and the communities at large. So the MAVEN Project started with a group of physicians, that the core of which began through relationships with some medical school alumni associations. Harvard, Tufts, UCSF, UCLA, Stanford, and several others were some of the initiating medical school alumni associations that partnered with the MAVEN Project to recruit some of our physician volunteers. When we think about who comprises this wonderful group of physicians who so generously donate their time around the country, our physician volunteers range in specialty from primary care to over 30 specialty fields of medicine. They're extremely seasoned in their experience. They have spent decades and decades of their time and career dedicated to and committed to their respective specialties. They join the MAVEN Project for a couple of reasons. Number one, they're looking to find a way to give back, to flex the muscles that they've developed their entire careers, and volunteer in a way that they can feel professionally and personally rewarded. The opportunities that the MAVEN Project brings them are extremely flexible and convenient. So our physician volunteers volunteer a minimum of 4 hours a month. Many of them volunteer more. But because we're using telehealth technology, physician volunteers can truly be anywhere. And really this minimizes the geographic barriers that keep parties from connecting, from communities and clinics from connecting to physicians that generously want to donate their time by leveraging telehealth technology. The MAVEN Project credentials and covers our physician volunteers for malpractice insurance, for MAVEN Project related activities, and they're really culturally sensitive and really looking also to join a community of physicians that are looking to volunteer. And so our physician volunteer corps is growing and is a wonderful group of physicians who really represent a group of sort of best-in-class or world-class physicians. And we're so grateful for all of the physicians who have volunteered to date to become part of our volunteer corps. From the perspective of the clinics that we're connecting our physician volunteers to, they are so grateful for the ability to connect and develop relationships with our physician volunteers. Our physician volunteers bring knowledge and expertise local to the clinics that make it easy to help patients and populations of patients. What you will see are some quotes from our clinic providers reflecting on their interactions with our physician volunteers. In general, our physician volunteers are perceived as extremely knowledgeable, extremely professional, extremely thoughtful and culturally sensitive, and very resourceful in terms of thinking about determining what appropriate care plans could be for patients given the resources that may be around each patient or population of patients. The next page really showcases a quick video that you'll see around what it's like for a physician to volunteer with the MAVEN project, and from the perspective of some of our physician volunteers, what the experience has brought to them and why they believe that volunteering at the MAVEN project is an important endeavor.
My feeling about medicine is my friends who are attorneys and accountants and business people, when they retire, they're gloriously happy that they're done with it and they retire.
It's not a switch that you can turn on and off, so I can't imagine the moment in my life when I would say I no longer want to caregive.
They longed for the thing that pulled them into medicine in the first place, which is to take care of people.
So this is a wonderful vehicle for people who are retired who share the same sentiment that I do.
At the MAVEN Project, we realize that doctors want to volunteer. They want to share their wisdom and experience, especially with patients that lack access to care.
The Affordable Care Act has made a lot of strides, but there still remain tremendous numbers of people who have access to medical care theoretically, but in practice there is no access, particularly in rural and inner city areas.
In fact, 62 million people in this country don't even have access to basic primary care physicians.
Many are low income, many are underinsured, and many do not speak English as their primary language.
It's a population of people who have difficulty even getting for themselves what they deserve because they're not connected to the system very well.
Often it isn't a matter of seeing a local cardiologist or going to MAVEN. It's often nothing or MAVEN.
And so what happens is these patients who need specialist care often end up waiting until things are really bad, and then they end up going to the emergency room, or they've waited so long that their disease has progressed. I think that telemedicine is really, it's the house call of yesteryear.
We're trained and board certified in whatever field we have chosen. Some of the fields may be primary fields, other fields may be subspecialty fields such as mine.
And so we realized that we could identify clinics that could use these physician services, match them together, and as Match.com meets the Peace Corps, that through telehealth we could bring the need together with the expertise and physician experience.
And the schedule has certainly been easy to work around, and geographic mobility has not been a problem at all.
Not hard. I think you have to know how to turn on a computer. You have to follow instructions, because the IS people in this organization really spoon feed us.
Obviously, if there's anything that needs to be done hands-on, then the provider is there as to help moderate it, to facilitate that interaction.
Doesn't even interfere with your regular schedule very much. You sort of schedule a half day and you don't have to travel anywhere to do it, and you can schedule a time that's convenient for you. The telemedicine has reached the point at which you can really connect to people. There's a sense of intimacy that's almost as good as having the patient in the room.
I have a very vigorous, busy schedule, and weeks to months in advance, I just carve out some time, block it off, shut my door, put a little note on the door saying, "Conference call, do not disturb," and the rest is history. So I think that's a real advantage for someone who's retiring, is that they want to escape some of the shackles of day in and day out life in a professional environment, and yet they're able to have the same professional satisfaction wherever they might be.
Because I have things like MAVEN, it sort of kept me in medicine.
And we all have had a long, rich practice career, and we're just not ready quite yet to put that on the side burner and pursue another life altogether. I think we're going to see more and more of this, and I think MAVEN is going to be a leader, and also is going to be providing exciting opportunities for physicians in all specialties at all ages.
Now we'll take a little bit of time and highlight the MAVEN Project services. The MAVEN Project is focused on providing the following 3 service offerings: Number 1, educational sessions. Number 2, clinical mentoring. And number 3, advisory consults. All of our services really strive to do the following: to, number 1, close the gaps on access to care. Number 2, to provide frontline primary care providers working in safety net clinics with resources and relationships that they might not ordinarily have to help them manage day-to-day clinical practice and care for their populations of patients. And number 3, to really improve the satisfaction and sense of competency of primary care providers caring for these at-risk populations around the country. Now we will get into the details of each of the service offerings. Educational sessions. Our physician volunteers deliver didactic geared towards the practicing primary care provider via telehealth technology on a variety of clinical topics. These didactics are really geared towards what a primary care provider would need to know or want to know about their respective specialties. So examples of these didactics that are followed by a 15-minute question and answer, they're delivered via live video conferencing, video and audio, and accompanying PowerPoint slides, range in topics from the 101 of rheumatoid arthritis, acne versus eczema, depression in teenagers, opioid management, and the topics go on and on. We have about 10 to 12 educational sessions each month that every clinic partner of ours is able to, and every primary care provider in these clinic partners of ours are able to sign up for. We also provide customized educational sessions for clinics or networks of clinics that would like to have a deep dive in a variety of topics. So it might be a network of clinics that are looking to have a series on type 2 diabetes, and we can bring an endocrinologist to the table and have them present a series on type 2 diabetes that's really clinically pertinent to whatever the clinic is looking for understanding. The goal here is to increase the knowledge capacity of the primary care provider, give them the ability to meet some of our physician volunteers, and really provide an opportunity to ask live question and answers to our physician volunteers. The second area of focus is clinical mentoring. And our physician volunteers pair up on a one-on-one basis with primary care providers in the field in a 3-month program as a minimum. So it's 30 minutes twice a month for a minimum of 3 months. And these pairings between the mentor and the mentee are intended to be a mechanism to really be an additional level of support for the primary care provider in the field. Our mentees might be new primary care providers, so new nurse practitioners, physician assistants, or physicians that are new to clinical practice. They may be primary care providers that are new to a practice, or they may be primary care providers that are not new to practice, but that would just benefit from some additional levels of support. Our mentors are physicians who have spent decades of their career in clinical practice in the ambulatory care environment, that are independent, non-judgmental, confidential resources that the mentee can connect with and discuss topics related to practicing, being a practicing provider. The sessions are really geared towards the needs of the mentee. Some of the topics include how to manage, a complex day at work. How do I get 10 minutes of a lunch break when I've got patients in 3 examination rooms and a waiting room full of patients? How do I humanize medicine when I've got a computer in front of me, but there's a human being behind it, and I'm struggling to document when I have a human being and his mother sitting next to me? How do I have difficult conversations with patients when I want to spend more time with them, but I'm not able because I have a limited amount of time and I have other patients I also need to see? The mentees are, and the mentors both, feedback to date has been that this opportunity has been extremely beneficial and extremely rewarding to both parties. We're actually studying the impact of the clinical mentoring on primary care provider burnout in one of our health system partners. And the goal here is to really both create an additional level of support for primary care, to help improve the job satisfaction of primary care providers, to stabilize the primary care workforce and retain primary care providers in their roles by giving them the resources and tools that will help them enjoy their job a little bit more perhaps than they are, and sort of managing sort of day-to-day practice. And the third area of focus for the MAVEN project, which is really our bread and butter, is what we call the advisory consults. And this is an opportunity for a primary care provider in the field and in a clinic that we're partnering with to connect with one of our physician volunteers of really any clinical specialty to discuss either de-identified clinical cases or population health approaches to conditions. For example, a primary care provider in a clinic might be struggling with 3 patients with uncontrollable high blood pressure and might want to speak with a cardiologist and discuss each of these patients in a de-identified manner with the goal of helping to either validate a care plan, augment a care plan, or determine really which patients truly cannot be managed in the clinic and help to effectively triage patients to an in-person specialist. In addition, the primary care provider could also schedule time with one of our cardiologist physician volunteers and discuss population health approaches to conditions. For example, it might be all patients that come into my office with high blood pressure on a particular medication make me a little bit uncomfortable, and I'd love to learn a little bit more about how to the medication or how to manage the condition so that for all patients that come in with this profile, I feel like I have a little bit more information and education. So right now, the goal is that you could schedule as a primary care provider in the clinic a time in the future. You could schedule time later today or tomorrow or in the near future with a physician volunteer, and you will know that you have dedicated time with the physician of your choosing to run through the questions that you might have. What we are adding in over the next very short period of time are 2 additional features. One we call Available Now. So you might be, as a primary care provider, in the room with a patient who had a EKG rhythm strip taken in the office. And you might read it and think that you'd love to run that rhythm strip by a cardiologist to just validate the read and the care plan. Well, coming soon, you'll be able to step out of the room with the EKG rhythm strip, connect with one of our cardiologists, have that quick consult, step back in the room with the patient, and validate the read of the EKG and the care plan, and then the patient is on their way with a sort of validated care plan. In addition, we're adding in an asynchronous or an e-consult messaging where you can either send a secure message with or without an attachment to a physician volunteer that you have a relationship with, or to the group of physician volunteers, for example, the entire gastroenterology group. You could send a message to the gastroenterology group, and the first available gastroenterologist would take that e-consult sort of off the queue and send a response. Our goal here is that we are providing access to the primary care provider when they need it, how they need it, and where they need it in a timely fashion. You can schedule time or grab time with a physician volunteer of ours for 5 minutes, if that's all you need or have, or for an hour. Our physician volunteers have time and knowledge and expertise, and all they want to do is share that with our primary care provider and clinic partners. So a case example, just to illustrate an advisory consult, is that we are working with a group of free clinics in one geography where one of the clinics was very generously recipient of some some drugs that were supplied by a pharmaceutical company in a closet. And the drugs were sort of the latest and greatest diabetic management drugs. And the challenge with this clinic was that the primary care providers were so busy, they really didn't have time or comfort, given the lack of time, in utilizing some of the latest and greatest drugs for their patients. And so the closet effectively remained closed. What happened was one of the primary care providers scheduled maybe a 30-minute video conference call with one of our endocrinologists. They virtually sat down together and mapped out every drug in the closet and which patient populations are most ideally suited for which drug. And now there's a list that has circulated through all the primary care providers in the clinic. The primary care providers are opening the closet, using the drugs. The patients are taking the drugs, and health outcomes are improving. So even a 30-minute consult can have an enormous impact on a population of patients. So in terms of how it works for advisory consults, we like to keep it pretty simple. We'll give you a login to a system. You choose a provider. You send an intake form that says why you want to connect with the provider. You have an appointment, the consult, and then we do collect information on the back end, a quick survey to ask about your experience and the sort of value of the consult. We do the same for the physician volunteer as well. In terms of how we're different in the market, so the MAVEN project is a 501c3. We are funded primarily through philanthropy and some non-clinical administrative fees, which are small fees that help contribute to our operating costs, to the credentialing of our doctors and the malpractice insurance, for the technology platform, for project management that we provide to really get the service off the ground and managed. And between the funding sources, effectively, we're able to provide expert care truly to the uninsured and the Medicaid populations that don't have access or have limited access to care. Our physicians are really an innovative and previously untapped workforce with truly a sole goal of supporting clinic primary care providers in their communities that they care for and building trusting relationships with the clinic staff. So what's most successful from our perspective is that primary care providers in the field, in the clinics that we're partnered with, feel like they've developed a new network of relationships, which are our physician volunteers, that they can call upon when they need and have questions. Again, we are available in person when needed. We fit into a primary care provider's workflow and patient time needs. We fit their schedules, not the reverse. And finally, truly, the telehealth technology removes barriers. The lack of travel and for both our physician volunteers and the minimization of travel for the patient, in terms of the patient can now have their care optimized in the local setting for them, is really ideal. And we support all of our physician volunteers with credentialing, malpractice insurance, and onboarding. In terms of achievements to date, at a high level, we've deployed physician volunteers in 30-plus clinical specialties and growing. We're in an early growth phase at the MAVEN project. We're coming out of a successful pilot phase, and as we're growing, we are doing a couple of things. We're increasing our physician volunteer corps. We're increasing the clinics and the networks of clinics that we are serving and the communities that we are serving. We are growing our funding base, and we're optimizing our technology platform. So over the past year, we've grown to 6 states. We've reduced wait times and in many cases eliminated the need for out-of-clinic specialty care appointments by really bringing the knowledge and expertise local and keeping the care local and optimizing it. We really enable clinic primary care providers to manage complex medical care in-house as appropriate. And we've increased the knowledge capacity in the clinics, educated and empowered providers, and impacted population health in the states that we've been present in. So we would love you to join us. Certainly for all of you listening, we're seeking additional clinic partners. We'd love to work with you, and we're seeking to add hundreds more clinics nationwide and in particular in California. In addition, we're seeking physicians. We're always seeking physicians to volunteer to meet our growing demand. We seek physicians that are of primary care specialties, pediatrics, internal medicine, family medicine, and also medical subspecialties and surgical subspecialties. And finally, in terms of financial support, we are launching an effort to raise some additional funds. And if you are aware of any funding sources or interested in connecting us with a source of funding, we would love to hear from you. We look forward to hearing from you. My contact information is here on the screen in front of you. Best to reach me by email, llevine, Levine, @mavenproject.org. Thank you so very much.